So I want to welcome everyone to our International Staffing webinar. And it's a pleasure to be here with everyone. Appreciate you taking the time this morning to be with us. So I want to jump into our learning objectives. And really, this is more of an educational session. So Chris, if we can move to the next slide and talk about the learning objectives, that would be great. We want to gain an understanding of the advantages of incorporating international healthcare professionals into your workforce and facility. We want to help identify the potential challenges that can occur and how to navigate a path forward. And we want to propose a program framework and infrastructure to ensure your facility and the candidates that will be setting you all up for long-term success. So I'd like to introduce our speakers, and I'm sure each of them will talk about themselves a little bit more as we move into their slides. But just I'm Sherry Culp. I am the President Emeritus of Qualivis. We'll also have Ryan Nelson, who's Director of Business Development, Guardian Healthcare Providers. Ron Hoppe is the CEO of Worldwide Health Staff. And then Nancy Luce is a fellow member of our Qualivis team, Senior Vice President, Client Services. I'd also like to mention that this program is being brought to you by our strategic partnerships. So I'd like to invite Joe Green and Ann Brander with TCIS, also known as the Tennessee Hospital Association, to welcome their members.
Thanks, Sherry. Good morning, everybody. I hope you've had your cup of coffee or a cup of tea this morning or whatever helps get you started. Appreciate everyone joining the webinar today. My name is Joe Green. I'm the Senior Vice President for the THA Center for Innovative Solutions. We're a division of THA, Tennessee Hospital Association, and we are proud to have this relationship with Qualivis that we have had for many years. And they are our expert in this area of staffing, travel nurse, and so forth. And so we look to them to help provide education to our members around the state. And this particular topic is something that's been hot, as you know, a lot of discussion and interest around international nursing. So again, welcome, and hope this is a valuable time for you this morning.
Thank you, Joe, and thank you, Ann, for being here with us as well from THA and TCIS. And I believe we've invited also some members from the Mississippi Hospital Association to join us this morning. It's probably early for them as well. But Perry Edgar will be with us in a little while. He had a prior commitment, but he will be on later. And just want to talk about the strategic partnership that we've had for a really long time with these hospital associations. So for those of you that don't know, Qualivis is a workforce solutions company that was created by and for hospitals 20 years ago at the South Carolina Hospital Association through a Duke Endowment grant. We were acquired by IA Healthcare 3 years ago, and we've continued our mission of supporting healthcare in communities and in healthcare systems through our partnerships with 27 state hospital associations. So in order to understand maybe where this international piece might fit, we want to share with you at least some national job volume data related to the nursing staffing shortages that we're experiencing now. I don't have to tell you that we are in a workforce shortage. Just go try and get a sandwich at a restaurant today, right? So it's not just healthcare, it's every industry at this point. But one of the strengths of our partnership with so many associations is our ability to share relevant data with them, and to them have them then share that out to their members. And then what you'll see on this slide is currently there are over like 203,000 open RN jobs right now. These are permanent jobs. These are not travel jobs. They're not temporary jobs. This is the pain that our hospital systems are experiencing right now. The open jobs have decreased by about 1% over the last 4 weeks. So that's not even a a drop in the bucket. And as you can see, that green mountain that grows, those are the actual jobs that are open. But if you'll see the little squiggly line, you'll see those are the jobs that are being posted and filled. So there is that gap, that very large gap between what's being posted and filled and then the actual vacancies that we are experiencing, particularly in nurse staffing. So if you think about that compared to, January, February of 2020, we'll call it the pre-pandemic world, we were seeing about 100,000 open RN direct hire jobs. So in order to help fill these open jobs in our systems, we're supporting our hospital association partners by sharing knowledge and strategies of many workforce solutions, including international travel. International travel is not going to fix your problems, but we certainly think it's a viable solution. And that's why we wanted to bring our experts, people that we trust in this world, to share their expertise this morning with all of you. And so at this point, I'm super excited to hand the presentation over to Nancy. Nancy, good morning, and thank you for joining us as well.
Sure. Good morning, everyone. I'm very happy to be here. I'm Nancy Luce, part of the International Healthcare Advisory Board supporting Qualivis. I've been in hospital staffing for 20 years and have had experience bringing on, helping to manage a program, bringing on international nurses for a large hospital system, and have also learned a ton more from being on the advisory board. So at this time, the progressive hospital systems, because of nursing staffing crisis, really, progressive hospital systems are looking at all different ways to ensure a sustainable pipeline, not just relying on developmental programs internally and their own hiring, and using traveler and temporary staffing as good business decisions, but also all of the other ways to ensure that nurses and allied health professionals are coming to your health system. The U.S. projects that there will be 438,000 nurse-related new jobs by 2026, which is scary. Allied demand for medical technologists and physical therapists has been real for quite some time, continues to grow. The Philippines supplies 20% of all foreign nurses in the world. And I've learned that that is really part of how the Philippines keeps their country fiscally sound is this as an import that they educate and plan for. And then it says it again, the allied demand for medical technologists and physical therapists. Next slide, please. So are we doing this as a poll or just discussing? Well, I'll go ahead and speak to it. So right now for hospital systems, the question is, what is your current biggest workforce challenge? Is it staffing shortages? Is it burnout of your own staff? Oh, we are doing it as a poll. So would you guys go ahead and vote? If you are with the hospital system, vote on what is your biggest workforce challenge. Okay, go ahead and finish. We can see the results. Yeah, and Sandra's right. It's really all of them. So staffing shortages, obviously the 82% is huge. We can't even discount the other things. Our current nurses need some respite time or have moved out of inpatient nursing to do something easier, or have moved on, or just retired from nursing, taking a while to fill the position, and then the experience levels of available clinicians. It used to be that you had the choice to only hire experienced nurses, but now with the nursing shortage, that isn't always the case. Next slide. So what international staffing is it is a long-term workforce planning solution. It's not a quick fix, but getting started is the thing that needs to be done, because it does take a while for it to be done carefully and ethically and in tandem with your staffing planning and needs. It does take a while. There's obviously immigration and new licensing and other things involved. It is a source of strategic partnership with other staffing companies. IA and Qualivis do not fill international nurse positions and allied positions at this time. So I wanted to make sure that you understood that. What our role is as consultative, as liaison, helping to set up the program, in building an internal stakeholder company, determining what your needs are, where they should go, setting up the hospital to receive them well, to help them assimilate both clinically and culturally for long-term success. So that is what our role is. And then it is also a significant investment into people and processes. So for example, bringing international hospital professionals to you does involve some investment, but the rewards are long-term staff, more cultural sensitivity, an improvement in your diversity and inclusion. It definitely benefits that. It's also people who are, to make the transition to come here by international staff. They are invested into you, and then by doing things that help set them up for success, both assimilating to a new country and to patients in different settings than they're used to. Putting the time in your hospital system to welcome them absolutely helps predict success. It is not a quick fix. It does take some time. It is not a transactional vendor relationship, because this is a long-term partnership, and it's not something that can happen without significant oversight and executive attention. Next slide. So is international staffing right for you? So one of the things I said at the top was that really progressive healthcare systems are looking at everything, like putting effort and investment into all of the ways to ensure sustainable staffing now and in the future. And this can be another arm of it. If investing in this program, it will help. By investing, it will help ensure long-term staff. It does improve diversity and inclusion goals. It does achieve savings. There are ways to project and realize savings from using international healthcare professionals. Comparing it against traditional travelers, the bill rate is less. The timing can be either direct hire, where there's a fee paid upon hire, of course we know that, or temp to perm, where they are contracted and still employees of their staffing vendor until traditionally 3 years, when they transition to your own employee. And then so those are all part of the decision making. And then the question is, how will your team support international healthcare professionals? So there are a lot of ways to set up your system to welcome them well. Of course, it starts with determining what units and what positions, what units and departments would be best to approve them to be accepted into, and building up having a project champion, building up a stakeholders committee internally to include operations, and talent acquisition and learning and organizational development and diversity and inclusion, to have ambassadors for them and to help introduce them to community support. And then also things that help with looking at the different demographic of patients and predicting where they will be successful, and adding to the training and orientation the changes that are different from their home country. It takes internal investment to do this, but the rewards are long-term additional staff, additional sensitivity culturally for your internal employees, improvements in the number of diverse employees you have, and the ability to support the community well that you serve, and also to just have a significant other pipeline of experienced staff. Next slide. So there are two different models with bringing international healthcare professionals into your health system. Direct would be as in a fee is paid upon the hiring and the start date for international healthcare professionals. And both of the companies that are going to speak to you this morning, they both do bring more than nurses, but sometimes not just being a nurse, but sometimes I say nurses, but I really mean all of the positions. But anyway, with a direct model, of course, it is the fee upon hire for the recruitment and efforts and immigration and everything involved. And then in the indirect model, which is traditionally temp to perm, and Ron and Ryan will speak more to these, they are contracted and then convert to become your employee at the end of successful 3 years. And so first, next slide. I'd like to introduce Ron Hoppe. He's the CEO of Worldwide Health Staff. He is a recommended partner of Qualivis that for international healthcare staffing. These two are here today from these two companies to speak to you and tell you about their programs and ask and answer any questions. But of course, you are welcome. Our services to you as clients would be to support any staffing vendor that you are working with and to help enhance that experience for you. But Ron, very happy to have you today to speak to your direct hire program.
Nancy, thank you, and good morning, everyone. Hope this Wednesday morning's off to a great start for everyone. So I'm going to take about the next 10 minutes or so and share with you on the opportunity to recruit healthcare workers from abroad in a direct hire permanent placement model. As that title suggests, you are able to recruit international experienced healthcare providers that when they arrive in the United States, they on day one of employment are your employee. You will have them on your regular payroll, and you would pay them the same rate of pay and extend to them the same benefits as you would extend to any other similarly qualified staff member that you have. So that is just a really quick summation of direct hire. If anyone on this call has had any experience with international recruiting in the past, let's say 10 or 15 years ago, at that point in time, international recruiting, when you were talking about international recruiting, you were essentially talking about registered nurses, and you were talking about recruiting either in the Philippines or in India. Much has changed on all of these fronts over the years, where today international recruiting is no longer just focused on registered nurses. As the supply and demand gap across all health occupations continues to increase, US healthcare employers are increasingly looking at international recruiting, not only to respond to their nursing needs, but also to respond across most clinical areas, and in more recent times, even across support level positions within the organization, and can perhaps elaborate a bit on that if there's interest or questions in the Q&A period. Furthermore, the focus of international recruiting today has very much shifted away from the Philippines and away from India to include many other regions in the world. India is a unique case in that they have very unique visa processing constraints. And while there's many very, very well qualified Indian applicants, the visa processing system simply is such at the current time that they are not viable candidates because of the length of time it would take them to navigate the US healthcare system. Now, when I say that we've also moved away from the Philippines somewhat, I should just elaborate a little bit because as was pointed out in an earlier slide, the Philippines is still by a large margin the largest provider of nurses around the world. What has changed, though, is we find ourselves increasingly recruiting Filipino nurses while they are working outside of the Philippines. There are very many very good nurses working today in the Philippines, and increasingly the caliber of the healthcare facilities in that country are improving. There are an increasing number of JCO accredited hospitals there, but we are, as I said, increasingly able to find well-experienced nurses of all nationalities, including many Filipinos, working, for example, in the economically developed countries in the Middle East. These would most commonly include countries such as the UAE, as Qatar, increasingly Saudi Arabia, where there has been billions and billions invested in healthcare infrastructure, and a few others. So as we focus on identifying, sourcing, and recruiting the candidates that healthcare employers across the country have the greatest need in, we find ourselves focused very much in that region of the world, the Middle East or the Gulf region. Increasingly, again, Western Europe, particularly the UK, is becoming a good source of candidates looking to live and work in the United States. As I said, Philippines certainly remains a viable market, and then sort of an ancillary market to all of this would be Canada. So that's the focus of recruitment around the world in our direct hire model, and I think you would find that in all direct hire models. I think one of the key aspects of both models of international recruiting is you can expect to find candidates that are going to have on average more than 5 years of nursing experience. In many parts of the US, employers are able to recruit a substantial or a significant number of new grads, but we all know that you can't staff a facility primarily with new grads. It's that experienced mid-career nurse that is in such great demand. The advantages of recruiting in some of the countries that I've mentioned, particularly in the Gulf and Western Europe, is you are accessing a pool of nurses that is currently working in a healthcare setting that is very similar to the healthcare organizations that each of you work in. More modern, more Western-style healthcare systems with latest technology. And this is obviously a positive consideration when you put that up against recruiting nurses, perhaps from some developing countries. The other advantage that we have found over recent years when we are recruiting outside of the Philippines, is we are essentially recruiting candidates, and you can recruit candidates that have already made more, they've already made one international relocation. When we're talking about recruiting, for example, in the Gulf, they've made massive strides in building out their healthcare infrastructure, but the high 98, 99% of their healthcare workforce is imported from somewhere in the world. So here you have a large pool of candidates that are already have the experience of making an international relocation behind them. And we find that this is very helpful when they move to the United States, and their integration and assimilation here tends to go very, very smoothly. As you consider the pros and cons of the various international recruitment options available to you, I think one of the things to consider as you evaluate the direct hire model is the implications of the international recruit coming into your organization as a full-time employee, receiving the same pay and the same benefits as domestic staff. In this model, the economic model, you pay a flat fee per person. You're not paying an hourly tariff. Each candidate in our model of direct hire recruitment, I think it's pretty much the industry standard, is that candidates make, as part of their the offer you make to them, they are committing to a 3-year return of service commitment to you. And then, I won't take any time really this morning to speak about, the qualitative benefits that come from having an optimum number of core staff, permanent staff. There's much literature, scholarly research papers that have been written that speak to that issue very clearly. International recruiting has been embraced by employers across America. On the right-hand side of this slide is just a brief visual indication of the experience that we are currently having in terms of interest and uptake for direct hire international recruiting across the country. Next slide, please. Whatever model of international recruiting that you may find works best for your organization, I think one thing that I can say with great confidence is that employers that derive the greatest benefit from international recruiting are those that view this as the opportunity to establish a truly functioning pipeline of candidates over time. We hear this phrase pipeline used in a lot of different contexts, but in the context of international recruiting, you absolutely have this ability to establish a pool of candidates that will be processed. And even as they are working their way through that process, you have the ability to add to that pipeline as you gain further insight, further clarity into your local market conditions. Perhaps there's been a decision to expand or add a service line or make an acquisition. And international recruiting provides a very, very feasible way of establishing a pipeline that's going to provide you with more predictable outcomes of your recruiting activities over time compared to almost any other recruitment activity that you would undertake. And just on the left-hand side here is just a very brief illustration of a number of different healthcare organizations and how they have built this pipeline over time. So I'm not going to belabor this. The numbers here kind of speak for themselves. Just try to illustrate different types of employers. So at the top, a national acute care provider with 135 facilities in 38 states. You can see how they, even while they still have candidates in the pipeline, each year they're revisiting what their needs are and adding to that pipeline accordingly. So if you're part of a national organization with multiple facilities, this strategy can work for you. Next is national specialty care clients, 2,200 outpatient clinics, as well as clinics in 400 hospitals, regional long-term care provider, as well as a local small hospital system. The keys to success in direct hire international recruiting, as I believe Nancy pointed out very well, is this is a part of your medium to longer term staffing plans. And it does require some forward thinking, some forward planning. It allows you as the employer to access top talent pools. In the case of nurses who are BSN graduates, more than 5 years of experience, and the ability to access a pool of candidates that should be sufficient to meet your international recruitment targets. As you are evaluating any international recruitment provider, and particularly direct hire international recruitment providers, you want to be looking for someone that's going to provide you with a turnkey package of services that really encompasses all aspects of the recruitment process, the immigration, visa processing, licensure, relocation, onboarding, and retention. And then just I'll wrap up this part of the conversation this morning, again, just by saying two things. One, international recruiting is not just for registered nurses in 2022. And as you evaluate your staffing priorities and your staffing challenges, you know, I think the reality of the situation is that the challenge at hand is not a traditional recruiting challenge. It is a challenge that flows from a supply and demand imbalance in the workforce. And when the challenge is seen in that context, in the supply and demand context, then the viability of international recruitment comes even more sharply into focus. Because if you do have a supply and demand imbalance, you really have two ways of addressing that. One is increase the number of domestic hires through increased graduations. Nancy pointed out, I believe it was Nancy or Sherry, that there's 203 open permanent positions. Well, that's a big number, but to put that in some context, in 2022, there's going to be about 170,000 registered nurse graduates. So even if every one of those graduates passes the NCLEX exam, if every single one of them signs up for a bedside position, which we know is not reality, 100% of the new graduates in 2022 doesn't even fill the number of vacancies that exist today, notwithstanding retirements that happen every day, notwithstanding increased demand that's occurring every day as more and more people have access to the health. So in summary, direct hire international recruiting can help you address the supply side of this supply-demand imbalance, and it can be a valuable aspect of your medium to longer term staffing strategy.
Thank you, Ron. And now Ryan Nelson with Guardian Healthcare, a temp to perm international vendor.
Yes, thank you, Nancy, and thank you, Ron, as well. As mentioned, my name is Ryan Nelson. Fun fact, it's actually Ryan Willie Nelson is my full name, and I actually do live in Nashville, Tennessee. So that lands well in Tennessee, if you will. Unfortunately, similar to Willie Nelson, my mom did not allow me to grow up to be a cowboy. So I am here and have been with Guardian Healthcare for 14 years myself. The two branches of international recruitment companies under the EPIC umbrella are Guardian Healthcare Providers and Vintage Health Resources. Very soon you will see us starting to merge and change our branding to EPIC International. So that's what you will hear going through this presentation. But thank you for taking the time for us to speak about our indirect model. You can switch to the next slide. So between Guardian Healthcare Providers and Vintage Health Resources, we have over 50 years of experience with recruiting foreign trained nurses. We recruit from various countries. The majority of that pipeline does come from the Philippines for the reasons that have been mentioned by Nancy and also Ron and earlier in the presentation. But over the past 3 or 4 years, we have then expanded our recruitment net, if you will, to different countries such as Kenya, Nepal, India, Sri Lanka, South Korea. We're starting to see nurses come from Zimbabwe as well now. So we are starting to definitely see our fruits come from the labor that we've made over the past 3 or 4 years. Within that, we have a gamut of specialties that we cover and recruit for listed below. So we do have med-surg, ICU, NICU, to name a few. As Ron mentioned, similar, our average experience within our pipeline of nurses is 8+ years. And the agreement that we have with the nurse is for 3 years as well. Some of our big clients are listed to your top right. And one big one as well too that is not mentioned on there, we are one of the preferred vendors for community health systems, CHS, which as you know is a huge hospital system throughout the US. A couple of accreditations that we are Joint Commission certified, and also we are a founding member of AAIHR, which is an organization that works with making sure that there are ethical sourcing practices throughout all the different companies that work with international recruitment. Next slide. Let's talk about our process in this temp to perm model, if you will. It starts with the recruitment. We do have a lot of resources within the countries that we recruit. We have some NCLEX prep programs established within those countries that we work with, where we assist the nurses that have not passed the NCLEX as of yet to train in order to pass the NCLEX program. We also have some programs within particular countries, particularly in the Philippines, where we work with different hospitals to make sure that the nurses have opportunities to continue to get hands-on experience. Throughout that program, we do help the nurses receive their green card, which is very important. If you're familiar with international recruitment, there are several different visa options out there that you can utilize to bring a nurse in country. The key thing with the green card is that means that they are a permanent resident. So once the nurse comes in country, they are a permanent resident. And after their 3-year assignment, there are no additional requirements when it comes to immigration or financially in order for that nurse to continue to be here, to renew that visa, or anything that would prevent them from coming on board with the facility and working for any other employer. So we make the investment upfront. We take care of all of the financial burden with the nurses in order to help them get their visa, to help them get their training, to help them get their nursing license within the state that they're going to be working in as well, and also to travel to the United States. In turn, they sign a 3-year agreement to work an assignment at a facility that we have a partnership with. And after they complete that 3-year assignment, then they can go on board with the facility at no additional fee or cost. Once they come in country, they come here to our office right outside Nashville, Tennessee. They are with us for about 6 to 8 weeks. During that 6 to 8 weeks, we assist the nurses and they go through a clinical orientation. We have a director of education on staff that goes through clinicals. We have a clinical lab that the nurses go through as well. Also during that 6 to 8 weeks, we help them assimilate here into the United States. We help them learn how to drive first, get a driver's license, establish a bank account, purchase a car, purchase housing, and everything that they need in order to be successful once they are deployed to their assignment. We do send a representative of EPIC with them when they do get deployed on assignment to make sure they have everything set up to succeed. That way they're not worried about having to learn everything at one time as far as coming into a new country and then also learning how to live in a new country along with this new position that they have, which can be overbearing. We do assist the nurses as well in including their family on the petition. So they are able to bring their families over as well, which is a great thing for a return of investment. What ends up happening, of course, is usually the nurse brings in their family, especially if they have kids. They become a part of the community. They begin working within the community. And after 3 years is up, as long as it's a good fit with the facility and the nurses feel like they truly are a part of the team, they end up staying there at the particular location that we placed them at after the 3-year assignment is up. The key thing with us as well on this tip to perm model is that we are a partner with you throughout that 3-year term. So we just don't take the nurses, drop them off and say, good luck. The same director of education that we have that is during the clinical orientation, once the nurses arrive in the United States, has a / title. That / is clinical liaison. So during that 3-year term, if you have any challenges from a clinical standpoint, cultural standpoint, reach out to us. We are truly a resource to you. We are a partner with you as well. There have been times where we have gotten involved and gone through the remediation process along with our partners, in which we've brought in a nurse back here to go through labs to try to identify that challenge. We've had times where our director of education has gone and then shadowed the nurse on assignment as well to try to identify what that challenge is, and have had very, very high success in making sure that that nurse is really a good fit, identifying that challenge is and coming up with some type of remediation that works. If for any reason that particular nurse just is not a good fit after we've gone through remediation, you are not stuck with a nurse that's unproductive for 3 years. We would immediately remove that nurse and look at replacing that nurse from another nurse within our pipeline. So we are here for you during that 3-year term, a partner for you and a resource to you with this temp to perm model. I don't have to go too much into as far as the why recruitment is such, because Ron did a great job in that. So I will stop right there and answer any additional questions that you all may have for either myself or Ron.
Next slide. Another poll. What time frame do you think it will take to solve the workforce challenges that you are facing today? And we'll wait a minute for the results. So the majority, 2 to 5 years, which actually speaks to international healthcare, which can be a 1 to 2 year time frame. But yeah, I love and acknowledge those who said never, because it is an interesting time in hospital staffing and healthcare staffing, and appreciate the optimism of those from 0 to 1 year. So next slide, please. So yes, this really just helps to highlight the fact that international healthcare staffing can be one of your ways to ensure staffing. It is one to get started with, because it does take some time. But through all the highlights that have been mentioned today, these are experienced nurses who are well supported by their companies, whether direct hire or temp to perm, and can also be supported well by our Qualivis international support consulting as subject matters to help you through this process, whether it is to start to determine what are your goals, what are your needs, what kind of numbers are we talking about, what meets your needs best, indirect or direct hire? Is it one company to work with? Is it multiple? Who are the stakeholders internally? Who's your project champion? How do you determine the best places to assign the staffing to? It's not just about the units that are traditionally hard to keep staffed or where your open recs are at the time. There's actually some more information that is part of the analysis of where best to place them. It's setting up ambassadors internally who are from the same international background or willing to learn more to support people. It's setting up community resources. It's understanding that families come with the international healthcare professionals, and sometimes that brings some unique needs, and the things that your hospital system can do to help them assimilate both culturally and clinically, identifying the differences. It's recognizing that more than just staffing, this is something that helps your diversity goals. It helps your cultural sensitivity initiatives. And it can be one part of a sustainable pipeline to ensure experienced staff at the bedside for your patients. And so we're here for questions. If you have questions for us, Qualivis, or Worldwide or Guardian Epic, we'd be happy to answer them. Doesn't stop here. Post this webinar meeting, you're welcome to send any information or questions or requests to speak with us or requests to be introduced directly to Ron or Ryan through Sherry. And we very much appreciate your time. Chandler?
One of the things that I'd like to add, right, and having been a nurse executive in a hospital for more years than I'd like to admit, I've used international staffing, and Ron, you said this, if you did it 20 years ago, things are different. Now, I always use the indirect model where I was, which is just, that was my hospital's preference. I love the fact that we have partners that provide both models. I think both models bring a different advantages, right? And Nancy, you hit the nail on the head. It's really about going back internally into your hospital, just really establishing what those needs look like, and getting back in touch with your hospital association, whether that's in Tennessee or in Mississippi, if you happen to be calling in from either of those states, and have a conversation with your very trusted association partners there, and they can get you in touch with us. But one of the things that I really remember quite vividly is the dedication of this workforce that comes into our communities and into our hospitals to support our friends, our family, our church members, everyone that comes into our healthcare systems, right, for the care that we all deliver. And I think, Nancy, I love the fact that you touched on the families that they bring with them, right? We're primarily talking about nurses and professionals, but our workforce shortages don't stop there. There are dietary needs and EVS needs. And, sometimes these families are often willing to accept jobs at our healthcare facilities as well. And so I think that there are a lot of opportunities for them to fill multiple vacancies that are very painful to our healthcare systems today. And the last thing I'll say is, we do know, and I think I saw something in the chat about, where do most of these folks get placed, right? So I'll let Ron or Ryan really respond to the question, but, in my experience, where we are experiencing the biggest challenges in our healthcare systems are med-surg and med-surg tele, right? Our nurses today, guys, I'm just going to be upfront. Our nurses today want to go into ICU and OR and PACU and day surgery, right? And so how do we fill those really, really bedside med-surg tele positions? And a lot of these folks, from my experience, have helped fill those jobs. But Ron and then Ryan, can you guys maybe speak a little bit to that, right?
Yes, so Chandler has asked, is there one particular specialty in more abundance than others in international nursing? A growing shortage of med-surg nurses has led to more agency staff filling those positions. So Ron?
Yes. So in international recruiting, one of the really great things is you are able to access nurses' experience really in all clinical areas. Now, specifically to the question that says, is there one specialty that has more abundance than others? As a general comment, from my observations, the international recruitment space has become competitive as well. In the last 2 to 3 years, I've been doing this work for 24 years. In the last 2 to 3 years, we're seeing interest as never before, literally as never before. We find med-surg is very frequently the largest request for nurses when it comes to international recruiting. These nurses are available internationally. I wouldn't say that they exist with great abundance in the current market condition. But as you evaluate international recruiting, you can include all of your clinical areas in your planning for that.
Ryan?
Yes, I agree with what Ron mentioned. So there is an abundance of nurses that have med-surg experience because of the demand. They may not be as large numbers as it was, but we do see and try to recruit as many med-surg as possible because the bulk of our needs are in med-surg and ICU. A couple of things that were not mentioned, and I'll ask Ron to touch on his experience as well on this. I know that with the nurses that we recruit, just know that most of them are willing and able and will work the different shifts that are required for your particular location. So these nurses don't mind working the night shift. Some of them actually prefer it. And that is something that really does help a lot of the facilities that we work with our partners. Another thing too we didn't touch on is that one of the requirements in order for a nurse to come over is that they have to pass an English proficiency and competency exam. One of the things that always is a question and a concern for any facility that is looking at bringing in any international nurses is the language barrier. And just know that all these particular nurses have to pass an English exam in order to even receive their nursing license and also get their green card to come over. And then the other thing too is I know that a lot of the facilities within the Tennessee Hospital Association and also the Mississippi Hospital Association are rural hospitals. So can an international program work for a rural hospital? And the answer is yes. And I'll let Ron speak to his organization, but we share some of the same clients and are within the same states. We have worked with critical access hospitals in North Dakota, in Montana currently, and throughout the United States. And what we've come to find out, when we were hesitant to go into those states at first, because we knew that there really wasn't a community there to support the international nurses coming in. If you work with international nurses before, you know community is important. So we try to make sure that we place at least 2 nurses, try to do it at best, at least 4 really, to make sure that they have that camaraderie. But what we realized within the rural communities, what is the strength of a rural community as a whole? It's the actual community, right? So what happens is that we end up placing nurses in the middle of nowhere in North Dakota, really, I mean, talking about population less than 1,000. And what happened is that we placed the nurses there, and as soon as we placed nurses there, the community wrapped their arms around them. They asked them what they needed. They were giving them furniture, you know, they had furniture. And 3 years went down the road, and because of the support that the community gave them, those nurses are still in those communities. Even though when they were placed there, they had aspirations of going to California or somewhere else to be with their family. So it definitely can work in a rural community as long as they have that support. What has been your experience, Ron, when it comes to rural communities?
It's really evolved over the last number of years. I'm delighted to hear for your experience. And certainly international recruiting can work in very rural, very small facilities. but the incidence of those efforts being successful, I see, are declining, simply because of the competitiveness of the market and international nurses understanding full well the range of options that they have available to them. So while international recruitment can be a solution for each and every employer, it also needs to be recognized that the recruitment approach, the recruitment effort, the retention effort is going to have to be different across different locations, different geographies, different employers.
Chandler, my experience for positions we've placed are med-surg, tele, ICU, OR, and dialysis, or for some reason, there have been nurses available for those positions. Maggie has asked, what is the typical turnaround to when the clinician is brought into the program when they start their role? So Ryan, you first, and then Ron, when you have recruited a nurse or an allied health care professional, when they have connected with you to do this, when will they be started in the hospital system?
Yeah, so with the temp to perm indirect model, since the nurse is an employee of Guardian Healthcare Providers, we've already filed and started the petition process years ago. So we're starting to see nurses that we started this process a year, 2 years ago, now beginning to get to the last stage of the process. So we're now able to look at placing those nurses within the last stage of the process that we expect to come in country Q1, Q2 of next year, to offer those for assignment and interview to different facilities. But again, the only reason we're able to do that is because we are the employer. We've already started that particular process. So do know that process is not a 6-month process or so. We just have the advantage of starting the process years ago and now have nurses that are available in that last step waiting for an embassy interview. So we would be looking at nurses that are available starting in Q1 going into next year.
Ron?
Yeah, I think the direct hire model it works on a different timeline. So, and processing times vary over time. So the processing time pre-COVID, during COVID, now post-COVID. But to answer the question directly, currently we're finding that the time required from a time an applicant is hired to the time that their visa is issued is approximately 18 months at current processing times. We hope that will come in somewhat. Pre-pandemic, we were looking at 12 months, 15 months. Now we're looking at 18 months and sometimes even a little bit longer. But again, just to put that into perspective, as you reflect on where you were at, let's say 2 years ago, in terms of your staffing priorities and challenges, what you are facing today, and then if you contemplate what it is that you anticipate you'll be facing 2 years from now, when you have that time context in view, the time required to hire someone directly through international recruiting becomes very clear. The challenge at hand, I was interested in the poll, the majority of respondents indicated they think that this is an issue that's going to be with us for 2 to 5 years. That's very interesting feedback, and I'm all for being optimistic. But quite frankly, I think the notion that 5 years from now, many of these issues will have been corrected is perhaps overly optimistic. But to answer the question at hand, approximately 18 months, the individual arrives, and again, as your permanent employee.
And we're at time, so before Sherry closes us out, I did want to say, Maggie and others, that recently there's been an improvement in the NCLEX appointments being available to international nurses, and that has helped the timeline, where for a while they just could not get, so they're fully licensed in their home country, but to become licensed in the US, it was almost impossible there for a while to get an appointment to sit for their boards. And so that has improved. So that has improved the entire expectation of bringing international nurses and other healthcare professionals to your bedside. Thank you all for today. Sherry?
I have to find the unmute button again, right? So welcome to 2022. This is what we do every day. Thank you guys so much for joining us, particularly the support of TCIS and for MHA. And you know, we can send the deck out to you guys, and we would love to help you with this particular workforce solution through your association. So just let us know how we can help. Ron, Ryan, Nancy, thank you so much for your participation and your presentations, and hope everyone has a wonderful day. And I'll see you guys in a few hours.
All right, you all have a
Bye
good
for
one.
now.
Thank you.
Thank you.
Bye.